I heard this bring about Jimmy.
Good morning, Rotarians and guests. Welcome to the Rotary Club of Hudson. I'm Ron Strobel, the Sergeant at Arms. Our invocation this morning is by James Field. You're almost running now.
Well, I was going to start with the watchword of our faith, Shema Yisrael. Oh, he knows it. Oh, you don't know that one? Oh, that's right. I keep forgetting that not everyone's the same religion here. I was making a point. So anyway, I had not prepared my invocation, but what I will say is I think we could be all, after having been to the service learning presentations yesterday, I think we could all be thankful for our youth and just how sincere and intelligent and our future leaders, and thankful for Rotary and all the organizations that work with our youth, Boy Scouts and so forth, to prepare them for the future. So that's my invocation for today, is really giving thanks for the future, our future.
Thank you, James. And now to lead us in the pledge and the four-way test, Phil Tobin.
Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And the four-way test, the things we think, say, and do. Number one, is it the truth? Two, is it fair to all concerned? Three, goodwill and better friendship. Four, beneficial to all concerned.
Thank you, Phil. Do we have any guests, Chris? Okay. We are going to go back momentarily to something that we used to do when we had a fine master. He would always tell everyone's birthday that was during that month, and either the birthday people or the ones that weren't birthdays used to have to donate money. Well, I'm going to tell you who all has a birthday in January, but it's not going to cost anybody anything. But first of all, I can't read. Come on out of there. I know the first one though. Chris Barker, January 1st. Elizabeth Kowalik, January 3rd. Mike Swain, January 8th. Philip Budo, January 16th. And our famous Father Joe Boisel, January 17th. George Snyder, January 25th. Ralph Day, January 27th. I guess this guy's infamous. Rich Warfield, January 28th. And Phil Warburton, January 31st. So now we're going to do what we usually did then, and Chris will lead us.
Okay, I was going to say a lot of people were born in January. Then we got to that January 28th person. No, I'm just saying. Okay, if everyone would please join me in singing happy birthday to all the January babies. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. There we go.
Thank you, Chris. See, we all miss that singing, don't we? I've got one other thing. What? Oh, no.
About the Packers. January 28th was a very special day. There's a very famous hockey player that was born on that day. Can anybody guess who he was? Now, beside him. Played for Edmonton Oilers and Wayne Gretzky. So Wayne was born on January 28th. We're the same age, but he went to the NHL and I went to the beer league.
He's both been very successful.
One other thing I want to just take a couple minutes. I know that some of you will remember Chuck Obendorf, and this is not really about Chuck, who was our president in 95, 96, but his father, Charles R. Bob Obendorf, was 96, and he passed away this last week. Now, the important, where this fits in with Rotary, Bob was a generous gentleman. As a child, he always wanted a bicycle, but his family couldn't afford one. So as an adult, anytime he saw a discarded bicycle, he'd pick it up, restore it, and then give it to the Good Neighbors group in Akron. He redid over 125 bicycles, and actually in 2007 was recognized on NBC Nightly News as their person of the week. Now, this legacy was continued through the Bob's Bikes program in conjunction with the Hudson Rotary and the school auto body shop. We used to get the bicycles. Jimmy Sutphin was in charge of it in those early days, took the bicycles there. They rebuilt them. Then they went to the Good Neighbors. And then when the tech shop couldn't do it anymore, then we had a local bicycle guy, and I can't remember his name, but he did it for us for multiple years until we finally have turned it over to Bikes for Christ, I think it is, something like that. So that's why I bring it up, because Bob's Bike program, Chuck Obendorf, our president, donated $1,000 $1,000 to the school that they could use so that every bicycle went out, you know, properly repaired, went out with a helmet and all that stuff. So that's why I bring it up, because it was a significant part of Rotary's activities back up until just a few years ago. So just wanted to let you know that. Many of you will remember Chuck. Well, maybe not many, but a few of us. So now our president, Father Joe Boisel.
I tried to make a great entrance, but thanks a lot.
Thank you, Ron. I think the words that James was looking for earlier, Shema Yisrael, Adonai, Eloheinu, Adonai, Echad. Am I close? Hear, O Israel, the Lord our God, the Lord is one. Yes, right. I can certainly participate in that. Well, good morning, everyone. A few announcements that we have today. Let me begin with that. We are supporting the Boys and Girls Club of Akron. And so I think that's right, of Akron. Am I right about that? Yes, it is, sir. So we're collecting paper towels, shelf-stable snacks like cereal, crackers, chips, cookies, and the like. We're grateful that there was not a teacher's strike because that really would have put a heavy burden upon that club. But also AA batteries was another thing on that. So we give thanks that we didn't have a teacher strike, and we're supporting that club. Two different things, but yeah, if you have those sort of items or can stop by and get some, that'd be great. Couple other announcements we have today following this meeting is a board of directors meeting. So if you're a part of that board, then please stay and be part of that meeting. If you're not part of the board, but you're always interested in what's going on, feel free to stay as well and join and watch. The gala committee will meet next week on the 18th. And then on the 25th, there is meeting of the beer garden committee, which is, you know, I mean, come on, it's got beer in the name. So yeah, you should want to be part of that. I definitely am. Also, I want to say thank you to all of you who participated in the Random Acts of Kindness project with Hudson High School. I still have yet to go today, so I know that there's some of you who are still out there to do that. All of that being said, I'm going to invite Phil Tobin to come up here. Well, you don't have to come all the way up. I'll come down there and meet you. As he's, I'll come this way. We have among us someone who is a noted now celebrity,
Yes.
a 5-stone Paul Harris Fellow, and that would be your son, Tom.
Stop. Yes. Yes.
So I will invite Tom to come forward.
5 stones.
5 stones. I think so. Perhaps a general. Yeah. Let me get the flags on my fingers. Okay, you can hand me that microphone. You don't need that. And put this on. Yes, you can.
5 stones. It's so glittering. I can't even see.
Yes. I would like you to sing Rhinestone Cowboy whilst you put that on there, if you could. All right. Yes. Let's congratulate Tom on this great accomplishment. Just a little bit about the Paul Harris Society and Fellows. Any Rotarian who gives, is that $1,000 in a year? Am I right about this amount towards the Rotary Foundation or a certain number of approved funds, then can become a member of the Paul Harris Society and become a Paul Harris Fellow. It's a great honor and doing great work for Rotary and Rotary International. So yes, we should all aspire to become one and to be a 5-stoner, just like Tom back there. What a great accomplishment. So worthy of that. Okay, Jim is going to come. I'm sorry. Was there something else? He's going to come and introduce our speaker.
Good morning. I thought Rich was going to introduce the other famous hockey player up in Minnesota, Mario Warfield. Is he still playing? No, he's done? Okay. Well, to continue with this month is Health and Wellness Month. I had a distinct pleasure in being able to introduce Nicole Becher, who is a clinical coordinator with the Summit County Public Health Department, working with the program initiatives under communicable diseases and senior and adult services. The COVID-19 pandemic gave Nikki an opportunity to pivot from school administration into public health. She earned her bachelor's degree in sociology from Walsh University, master's degree in education from Malone University, and she created a career focused on client advocacy, program development, and community education on behalf of vulnerable populations across various industries. She today is going to be talking about the basics, talk about brain health and aging. The basic aims to kickstart conversations by laying a foundation of information around ways to promote healthy aging and reduce potential threats to brain health, no matter your age at this moment. To stimulate your brains early this morning, and everybody's in rare form this morning, so I think they won't have any trouble, is we got work to do to help her with this program. She's going to explain a little bit more, but as she's getting started, I'm going to hand out, and stapled together is a pre-screening, kind of a where are you to help public health and to help understand the effectiveness presentation. And then the first page and a half is just some questions, easy questions, just to answer your the status. And after she's done, there's a few questions on a post-test that we ask you to do. And she even brought pens, because maybe half of us don't have any pens with us, so that's a great thing. Yeah. Well, and also she has through presentation form a handout with all the slides. So if you need to look at it and take notes on it, it'll all be there for you. So very handy. So let's welcome a well-prepared Nicole Becher. And the people on the Zoom call are free. They don't have to do the question.
That is true.
Let's move forward about how to do that.
I understand that's cheating, though. So good morning. As Jim said, my name is Nicole Becher. I'm from Summit County Public Health, and I am part of a program with the senior and adult services, but I split my time between communicable diseases and the other program. I do a lot of outreach in the community, and part of that is grant-funded work, which is where the pre and post test come into play. Part of the grant money that we receive to do a lot of the programs out in the community come with deliverables that we have to be able to show. And part of that with going out into the community to do these presentations is being able to collect just some basic data on the effects of those presentations. So what you'll be receiving is a pre-test and a post-test. The pre-test is a couple of, it's like a page and a half of some demographic questions, but then also some questions on like basic health, brain health questions that we'll go through in the presentation. We want to kind of see what information you might already know pre-presentation. And then after the presentation, you'll go through and you'll basically answer the same questions again. And then when I get back to the office, I get to upload that information so that the state can see what it is that we're doing with all the funding that we receive. So we appreciate it. There is another packet that he's passing out as well that will have the slides. So you can have that to take notes on or to reference back to. There is a rack card of of our information for the health department in case you would ever want to reach out to us, as well as some general brain health facts from the administration for community living. And you can feel free to write and kind of answer through the pre-test while I go through the presentation. I know that everybody is on a tight schedule, so. Is that the 60 to 64? So some of you will receive a pre-test that has that age group in there because I was made aware of that age group not being on there last week. And so I made the correction. Some of them I had already pre-printed. So if it's not on there, you can just go ahead and write it in. What? Right. Last week when it was brought up to me that that age group was missing, a lovely woman, for everybody else who walked into the door that she knew was of that age group, she let them know that they did not have to actually fill out the pre-screener since they were left off from the age group. So the presentation that we're going to be talking through today is the basics of brain health and aging. It was developed for aging and disability network professionals. It aims to provide a foundation of education for adults and caregivers about brain health, including ways to promote healthy aging and reduce potential threats to brain health. Nothing that you learn today is going to be shocking. Nothing that you learn today should be anything that you haven't probably already heard at some point in time. The idea is that review and possibly thinking about some of these common ideas, maybe in a new way, will get you to have new conversations with other people, or maybe just sort of trigger the idea of looking into it further. Next. So aging and health. Adopting healthy habits, staying involved in our communities, and using preventative services, managing health conditions and medicines can help us maintain a healthy body and a brain. Aging well depends on a couple of different factors: genes, lifestyle choices, and environment. Some of those things we have a control over, some of them we don't. So even if you're healthy, changes in memory and learning as you age can include more challenges with multitasking, increased difficulty finding words, minor decreases in the ability to pay attention. I don't know about you, but I often find myself having a hard time paying attention, or I read the same sentence over and over again. However, at any age, you can still improve your skills, you can learn new things, and you can create new memories and improve your vocabulary. And so those are all things that can help protect our health and maintaining our independence. One of the main things with the senior and adult services program within the health department is that our main goal is to keep seniors and senior adults living in their homes independently as long as possible. Next. So protecting our brain health. Good overall health may help to maintain good brain health. We're striving for healthy eating, regular exercise, keeping our brain active, social connections, and getting enough sleep. Our brain is the most complex organ that we have. It's also one of the most important. And so that's why keeping it healthy is critical, not only now, but as we age. And even if you yourself are not of an age where you might think that it's important, you probably know somebody in your life who is of the age where it's probably more important than maybe you think that your own is, or you're coming in contact with other family members or coworkers. So it is important at any age. Next. So some of those things, like I said, it's not rocket science. It's not anything new you haven't heard of. They're things that we already know, but it's things that maybe you haven't thought about or you haven't thought about in quite the same way. So healthy eating. Area agencies on aging offer a range of nutrition services, and that is an agency that is here locally in Summit County, as well as all over Ohio. But they offer nutrition services, including congregate and home delivered meals for adults age 60 and older. Other programs such as supplemental nutrition assistance programs can help adults of all ages. So if nutrition is a problem and you're unable to access it, there are resources out there. So that's one of those things, like eating healthy, drinking, less sugar, eating less salt, making sure fruits and vegetables are part of your diet. Those are things that we know, we've been hearing about them since we were very little. And we might take those things for granted because we have access to them, but other members in our community, possibly our neighbors, maybe someone that we work with, they might come across a time in their life where they're not able to access it, in which case you might be able to be the person who is able to help direct them towards a resource. If you are maybe thinking outside of the box or thinking creatively, there are resources out there. You can always contact 211, which will take you directly to United Way, which is a wonderful resource. They'll direct you out into the community as well to other resources, or you can always contact us at Summit County Public Health and our department, and we will help get people where they need to be. But we have a lot of food deserts here in Summit County, and so having access to healthy food is not always a given. Next. Regular exercise is another one that helps keep our bodies fit, which also then helps keep our brains fit. Staying active is important not only for our brains and our body, but it's good for our heart and our circulatory health. It could even be helpful for some diseases. It reduces the risk for diabetes, heart disease, depression, stroke. It can help to prevent falls and improve connections among brain cells. As we're being active, it helps to rebuild neural pathways in our brains. So if we have some areas of our brain that might not be working quite as well, maybe from memory loss or other cognitive declines, they actually can start to rebuild new pathways so that you can actually start to rebuild new skills. Before you start any new exercise program, I can say, make sure that you talk to your doctor or your medical team to make sure that you are fit and able to do so, and make sure that it's the best fit for you. But falls are another real big thing with coordination, balance. It's a big thing that we don't necessarily always think about as we are getting older. I don't know about you, every time I go to the doctor, they always ask the question in the pre-op part of it where they're like, have you had any falls in the last year? And I never know how to answer that question because do I count if I tripped over the rug that was bunched up or whatever? And last weekend, I actually fell down my steps. I came around the corner of my upstairs and my slipper fell off my shoe or off my foot. It flew off my foot and I went stumbling down my steps. And my actual first thought, I kid you not, I looked at my husband and I said, I think I have to answer yes, that I have fallen now. That was my first thought. So balance is a real thing. Falls are a real thing. And so being able to build up that stamina is really important, to be able to keep that stamina. Next. Keeping our brain active, reading books, magazines, playing games, crossword puzzles, taking a class, learning new things, engaging your brain, picking a hobby or trying something new that you haven't done before. All of those things are challenging your brain. It's keeping those pathways clear and functional. I'm not saying that it is going to prevent cognitive decline. What I am saying is that it is going to at least help. It's going to stave it off as long as possible. It is going to help keep your mind and your cognitive abilities as sharp as long as possible. And it's easier to learn new things, I have found, when the pressure of a grade is taken off. So for those that are like, oh, I can't learn anything new, or school was a struggle for me, those sorts of things, you know, still just try. Push yourself to learn something new. When you take school out of the equation, it can definitely be a lot easier because grades aren't a thing. So learn for the fun of it. Next. Social connections. And I think this is definitely important, especially coming out of the pandemic times. I think we all can agree that we saw that social connections were definitely hindered during the pandemic, but I think we also learned how important they truly are. So you're all part of a group right now. You're part of the Rotary. What do you get out of it? Do you get something out of it besides just the civic action of helping out in the community? I'm guessing that you do. I personally am part of the Lions Club, and I know that beyond giving to the community in which my club serves, I also get something out of the social connections that I get from the other members that are part of the club. And so that's important. Those specific activity, including social engagement, does though have scientific, background to show that it slows or prevents dementia or Alzheimer's or other cognitive decline. However, it does show that it is meaningful and that those connections help with our mental health. And mental health, when it is intact and is going strong, affects our physical health. And all of that is good. So if we can keep those connections going and we can keep those connections strong, it's just going to be better for us in the long run. Next. There are risks, though, as well to our brain. Potential threats to brain health include accidents, alcohol, smoking and related risks, some medications or improper use of medicines, and certain health conditions. But not all risk factors we are able to avoid. Some of those are genetic factors that are passed down from a parent to a child. We can't control those. Lifestyle and environmental factors, we can we can control them. We can possibly change our environment. And so being aware of what's around us and being aware of our surroundings is important in having conversations. Next. Accidents is a huge risk factor. And I think something that we don't always think about. I think when we think of accidents, we think of like car accidents or something that is more, at more of a large scale. However, what we have seen recently in the news, and I think things that we have seen in stories and that, is that falls are part of that accident conversation. And falls are actually the leading cause of injury for older Americans, and they aren't an inevitable part of life. Home modifications can help prevent accidents and maintain independence so people can stay in their homes. As we get older, the risks of falls and other accidents, they increase. And you don't even, like I said, you don't even have to necessarily be of an elderly age. Who remembers hearing about Bob Saget over the summer? So Bob Saget was a comedian and an actor, and we learned that he passed away. And when we heard that he passed away, we were told that he died from blunt force trauma and had died in his sleep. And everyone was like, well, how did he die from blunt force trauma and die in his sleep? Like that, those two things didn't make sense. And come to find that he had fallen the night before. He had hit his head, but not to the point where he was unable to get up from the fall and was able to then go to sleep. but then he didn't wake up. Those things, those stories happen more often than we know. We know about Bob because he was somebody famous and it made the news, but those things happen all the time in our communities. And so it is really important to exercise to improve balance and coordination, making sure that we're wearing safety belts. I made the joke last week that we should always wear a helmet when we leave the house. Maybe not to that extreme, but making sure that we're being safe. You know, pay attention to our homes, pay attention to our loved ones' homes. If you see something that could be a risk factor, taking care of it. Reviewing medicines with a healthcare provider, making sure that your vision is checked, getting enough sleep. And again, it's not always just about you. You can also help, you know, your neighbors or your coworkers. If you see somebody who is like your neighbor who has always worn glasses and suddenly in the last couple of months, you never see them wearing their glasses anymore, it might be time to maybe ask, like, you know, is everything okay? I see that you haven't been wearing your glasses, you know, or something of that nature. Like, I just want to make sure that, you know, you're being safe. Because you don't want that person to have a fall or anything like that. So making sure that we're just helping one another. Next. Alcohol. I'm not going to sit here and preach. We are all old enough to make our own decisions. We know that alcohol can impair communication among brain cells. We know that it causes drowsiness, dizziness. It can cause memory issues. It can have long-term impacts on balance, coordination. It can be damaging when mixed with certain medications, but also it's all about moderation and it's about being smart when you make those decisions. Dietary guidelines for Americans in 2015 to 2020 describe moderate alcohol drinking as up to 1 drink per day for women and 2 drinks per day for men. As people age, though, they do become more sensitive to alcohol's effects, the same way we do with food and other substances that we put into our bodies. So the same amount of alcohol can have a greater effect on an older person than someone who is younger. So just something to keep in mind that as our metabolism changes, again, the same thing with other medicines, maybe the way Tylenol affected you as somebody younger might affect you differently now. Same thing with alcohol. Next. Smoking and related risks. If you're not a smoker, you are still at risk. And that's what I really want to kind of focus on, is that there are a lot of risks that come with being somebody who is not a smoker. And that's not just with secondhand smoke, but we're talking car exhaust. We're talking smoke inhalation from like fireplaces. We're talking wood stoves. Yes. Yeah. So the air pollution, the industrial smoke that we are inhaling all plays a part. And so sometimes it's a matter of thinking outside of the box and thinking about other ways, other things that can cause that same damage to our lungs. So candles, I never thought candles were an issue. And I heard that a few years ago that like the way they burn, there's, yeah, with the wax. So there are free resources available if you are somebody who is smoking or if you know somebody who is smoking that can help with quitting. And then always, you know, planning for activities that are outside for good air quality, index days. Avoid exercise near busy roads because of the smoke inhalation from the car exhaust. So when you're running by the street, that can actually be an issue. Maybe not so much in like this type of an area, but if you're like in a more inner city type area. And limiting the use of like indoor wood burning stoves, fireplaces that are not needed for heat. So electric fireplaces. Next. Medicines. Again, not here to say don't take medicine. That's not the point of this slide. The slide is to say that you are a member of your own health team. When you are meeting with your medical team, you should have a physician who allows you to come to the table to be a member of that team. If you have questions about your medications or you have questions about how you're feeling, you should have a physician who is willing to have that conversation with you. Not all medications interact together in an appropriate manner. And if you have multiple providers, not all providers talk to one another. So one provider might prescribe something, and then this provider prescribes something, but they're not paying attention to the fact that you are taking, this drug over here and this drug over here. So you making sure that you are being an advocate for yourself and discussing and speaking up to make sure that there aren't interactions that could negatively affect you is important. And if it's not speaking with your medical team, perhaps it's having a conversation with a pharmacist. I know myself, I live with a lot of chronic illness, and I have a lot of different medical team members on my own team, and I know they never speak to each other. And so I am constantly having conversations with my pharmacist, who is my best friend, and that is the person that I have talked to discuss the medications before I start taking it, because I trust that person to know the interactions. So next. Health conditions. Like I just said, finding a provider that you feel comfortable with and that treats you like you are part of the team. You are an expert of you. It's important to prevent, or it's important that when you're trying to prevent different conditions, that you are seeking treatment for those conditions, not only for your body, but for your brain's health too. I know it can be scary when you start to feel certain things and you might be afraid to know what it actually is, but it is definitely more important to have a name or to have an idea of what's happening so that you can address it than to sort of brush it under the rug. There are several health conditions that can affect your brain health, and many of those can actually be managed. Heart disease, blood pressure, diabetes, sleep problems, and even the avoidance of a stroke. And a lot of those heart disease, high blood pressure, diabetes, they can actually cause a stroke, which also then affects your brain health. So getting regular health screenings, talking with your healthcare provider about different issues or symptoms you might be having is definitely important. Next. Like I said, heart disease, stroke, high blood pressure. Keeping a well-balanced diet can help manage blood pressure and reduce the risk of stroke. These are obviously things that we know. Controlling our blood pressure, keeping our stress levels down, quit smoking, limit our alcohol. Heart disease can limit your blood flow through your body, including your brain. Blood pressure is that force of blood through your arteries, which can be problematic for the brain when it's too high or too low. So checking your blood pressure often, even if it's like when you're going into the store and you see that blood pressure machine at the drugstore, even that on the occasion is better than never checking it. Believe it or not, those things are actually pretty calibrated well and will give you a pretty accurate reading. But it's amazing how many people don't know what their blood pressure reading is. And that's something that can be easily checked because it's at every store that we go to. So regular screening is important. Next. Diabetes is another one where I think there's actually some misconceptions with as we get older into adulthood, where it's all lifestyle based or environmental, and we can control the onset of it. And some of that is true, but there's also there are new findings where diabetes is actually, there's a third type 1.5. And that is where there is an autoimmune component to it. So as we are seeing increases in autoimmune conditions in people, We are also seeing that as type 2 diabetes shows up in people, if they have other autoimmune conditions, we are also seeing that autoimmune component to the type 2 diabetes. So it is not just lifestyle in terms of, oh, well, they ate too much sugar, so they caused it themselves. That's not necessarily true. So making sure that you're being screened for things if you are outside of what would be typically seen as somebody who might have diabetes. So don't like rule yourself out is what I'm saying. Risk of heart attack and stroke, memory problems and Alzheimer's disease come with diabetes. And we can definitely help maintain and manage diabetes with nutritious diet, managing weight or exercise, though not everybody has a weight issue with diabetes, taking medication and keeping our blood sugars in control. And like I said, it's not all about just like if you ate a bunch of sugar, like that's what you did, because sometimes it's autoimmune driven. Next. Sleep problems is another issue that a lot of us end up having that can easily be addressed. Without adequate sleep, we are more likely to feel depressed, have attention issues and memory problems, or experience injury, that balance falling down the stairs thing. Common disorders are sleep apnea, insomnia, narcolepsy, and restless leg syndrome. Anyone in here a constant like foot tapper while they're sleeping? A couple. I am always moving my ankle while I'm sleeping. What you can do is, making sure that you are trying to get at least 7 to 8 hours of sleep each night, talking with your healthcare provider or sleep specialist, using a device or medicine if necessary, quit smoking, trying relaxation techniques. Sometimes it can be a matter of if you're taking a medication at night, it might need to be switched to taking it in the morning because perhaps there's something in it that is keeping you up at night. And so if you switch it to the morning, suddenly now you're able to sleep at night. So it's, they all kind of interact, all of the little steps and the helps and the risks, they all interact and are connected to each other. And so if you start looking at the whole picture, you might have a conversation with your pharmacist and go, oh, yeah, I do take that at night. Oh, I can actually take that in the morning. Great. Now I do sleep okay. So again, looking at the whole picture is important. Next. Dementia generally involves a buildup of harmful proteins in the brain, death of brain cells, and loss of connections among them. We know the risks are age, genes in some people, head injury, and stroke. We know that there are approaches that show promise in reducing risks of cognitive decline or dementia. There's obviously a lot of science and studies that are going on with dementia and dementia-related illnesses. Exercise, healthy diet, controlling high blood pressure, heart disease, diabetes, cognitive brain training, which is like doing word puzzles, staying active with your brain. Those types of things are going to help keep you healthy. There is no guarantee that it is going to stave off dementia, but we do know that it's going to keep you healthy and more mentally aware longer, and hopefully able to at least be in your best mental state if something were to come up. Next. So where to start? It can be overwhelming. Health in general can be overwhelming when you try to look at the whole picture all at once. So trying to maybe start with a small thing. It doesn't have to be the whole thing all at once. Like I said, start with one small step in the right direction. Schedule a health screening or a physical. Review your medications with your healthcare provider or your pharmacist. Add a daily serving of vegetables to your diet if maybe you're someone like me who does not like vegetables, even in your 40s. Start a new activity or a health journal. Find a new community activity that you can do to connect with people. Many insurance plans and companies, if you are still working, even often offer free and low cost wellness benefits. So check into those to see if your companies offer those. Medicare beneficiaries are also usually entitled to free annual wellness visits, as well as free welcome to Medicare visits within 12 months of joining the program. So there are lots of resources to kind of help jumpstart those wellness journeys. So it doesn't have to be like our New Year's resolutions. If you fall off, better off next year, I'll start again. Just jump right back on, start with the next little step. Next. These are our information on how to get in touch with us. We do have a lot of programs within our senior and adult services. Like I said, our big goal is to make sure that adults are able to stay in their home as long as possible independently. We are a great resource as a pre-case management service, in that if people are sort of declining cognitively and families don't know where to go, or perhaps an individual doesn't even have any family, and perhaps so you as an individual see like your neighbor and you have concerns, you can always reach out to us as a referral. We are able to go out and make assessments or to help those individuals who might not qualify for other services that are age-based in the community, like area agency on the aging, where it is I believe 60 is the age cutoff for them, but we can help somebody who might be younger than that, who might have some decline, and we can help point them in the right direction or provide those case management services and help get them the help that they need. Not everybody is going to have individuals in their life to kind of help them. And so we like to make sure that we are able to be that for somebody else. We're aging every day. All of us are. And our families are aging. And so everyone around us is. So this info is important for you and others. And so please share the information. The packets that you will get have the slides. It has other informations and resources that you can connect to. It has our information to the health department. So yes, any questions? Yeah. Yes, but it's not our slide that we made. So yes.
You know Demetria.
Yes.
She and I go way back.
Nope.
I can't remember what it's about.
No, it should be dementia. Yes. That's right. So in the first packet, you'll have the post test. And so if you can go through and answer those questions, that would be great. And at the end, when you go to exit, you can hand me, I'll be at the back, and you can just sort of hand me your packet as you leave. So thank you.
Cheating off of other people's.
That's right. There is no cheating. These are high stake tests.
I just want to reiterate one thing you said about pharmacists and how valuable they can be.
Yeah.
But because we're all faced with a lot of different pharmacies, and anytime you're on multiple meds, sometimes for whatever reasons, you end up going to a different pharmacy. So that all breaks down if you're getting your prescriptions at different pharmacies. And so there's a number of drug interactions that can occur across drugs, and the doctor, sometimes they know it, sometimes they don't. And if pharmacists are in different locations, they don't talk to each other. So just stay in the same chain.
Yes, I have learned over the years that even when I go into different providers that are like, if I use Cleveland Clinic, but I have different providers across, different disciplines. And when I go in for an appointment and they do the med review, and I list down whatever the medications are. And then meet with that doctor and the doctor prescribes something new. And then the next time I meet with a different doctor and that doctor runs labs for something and they're like, oh, well, your labs are off. It's probably because of this drug. We're going to take you off of it. And then I go back to this doctor and they're like, well, why are you off of that drug? And I'm like, well, this guy over here took me off of it. And they're like, oh, well, I didn't know that. And I'm like, oh, okay. Well, you know what I mean? Like no one ever talks. Nobody talks. And that has, for myself, it has been very, very frustrating as a patient. And so I learned to start talking with my pharmacist because I was like, I'm confused, I'm frustrated, and you're the only consistent person who is seeing all the medications all the time. So I really learned to kind of rely on that person to kind of help navigate those for me. So yes.
I have a
Yeah.
question. Thank you again for your presentation.
Yeah.
I thought it was very good. You stressed the importance of having physical evaluation by your doctor as far as physical health. How important do you see the corollary to that, which is mental evaluation, including depression and anxiety, which typically doesn't always come across the physical side with the doctor? He's not always the best person to evaluate that.
Right.
What can you do about that? Because that's a pretty important person thing for people who are getting older, that they all of a sudden find themselves in depression and anxiety, and that causes all kinds of problems from there.
Absolutely. Mental health is huge. It's a huge component that affects our physical health. I think we're learning that more and more and how that does affect. I'm a big component, or I believe that a big component to our overall health is taking care of that mental health piece. Personally, I am a licensed counselor as well, and definitely believe, talking to people, or whether it be somebody professionally or even just that social connection piece, making sure that you are keeping active in talking with people is important. We are wired as humans for that interaction piece. And so the more that we keep active and we keep from isolating, and you are keeping aware of how you're feeling, when you start to notice something is off, whether it be like, maybe you are feeling a little bit more anxious, a little bit more than normal, or you notice that you are isolating a little bit more than normal, or if you are normally somebody who is around a lot of people and, a friend watches out for you and is like, hey, I've noticed this about you, take heed in that, take warning, seek out help. It's not always about taking medication, which I think a lot of people are sort of afraid of when it comes to mental health. They're like, oh, well, I don't want to take Prozac. I don't want to take this or that. It's not always about that. You can do a lot of natural things to sort of change how it affects. A lot of times, it can just be getting outside and getting some fresh air, or getting, a dose of vitamin D. We're all deficient in vitamin D here in Northeast Ohio. And that affects our moods. And so it is really, really important to take that seriously.
Yeah, first of all, Rich, it's Rich Warfield, just to help you, it's January 11th, 2023 for the date part. Anyway, so a couple of things I was going to say that, first of all, I also, with the medications, you get a list of the interactions. And I actually try, most people just throw that away. I actually try and read it and realize one of my medications, if I eat grapefruit, it interacts with that. So I've got, so I love grapefruit. So
Right.
And then just a question. One of the questions you had in there, I don't think you gave the answer to, and it's whether Alzheimer's is the most common form of dementia. And I actually wondering, I mean, I know people with dementia that do not have Alzheimer's and vice versa.
So dementia has become more of a spectrum type disorder in more recent years. And they're finding that sort of like autism or even ADHD, that there's a spectrum to it. And so Alzheimer's is just one cause, but even like, for instance, my father had a stroke years ago and now has vascular dementia. It is not the same as Alzheimer's, but it does present the same way, but its cause is different. And so the same as Alzheimer's, dementia, Alzheimer's, they'll have the same cognitive symptoms, but its causation is different. So.
Thank you so much.
Thank you.
Okay, we'll give you a task today if you can. We have a wrote a buck drawing payout is $9, jackpot $304. So maybe make somebody really happy here this morning. They can, and the number
681188.
188.
I'm sorry.
Do we not have a winner? Did somebody sneak out early? 188.
Perhaps you could fill out the pre and post test.
Going once. 186 is not close enough. 188, nobody? Oh, crying out loud over here. Jim, what are we doing?
Silent winner.
Yeah. You know how close you came to losing your $9.
Put my hearing aids into that,
Uh-oh.
you know, and so.
And then the drawing here, let's see if we're gonna get it. The last.
Thank you.
Thank you so much for coming. We really appreciate it.
Thank you so much.
Helpful information.
I was just about to fall again this time off the page.
I fell off a scooter. I don't know if that counts or not. Maybe if you're going 20 miles an hour, maybe, I don't know. Is that a fall or is that a crash? I'm not sure. Those happen. All right, you guys have a great day. Be great. Make somebody's life better. Yeah.